All right, good morning, everyone. We're going to go ahead and get started. So if you want to finish up grabbing your beverage or whatever and make your way to a seat, we do have some extra open spots. I know they're up in the front, but you can come join us up in the front, no problem. So don't worry about walking through the crowds or anything. Well, good morning, and welcome to your orientation to the School of Public Health. My name is Jenny Porter, and I'm the Assistant Dean for the Enrolled Student Experience, and I use she, her pronouns. My role in SPH is to support all of you, no matter what program you're in, through your entire SPH experience, from your orientation today until your commencement. My background is in higher education administration. I have 18 years of experience supporting students through the start of their collegiate experience. Beginning your graduate degree, or continuing one for those of you returning to campus, is a major milestone, and I'm honored to be here to support you in your journey. If you have engaged with the online content course in Canvas, you may have explored a number of resources that have allowed you to identify the indigenous territories, treaties, languages in which your home and the U of M are located. As we start today, I would like to take a moment to acknowledge that the U of M is located on traditional, ancestral, and contemporary lands of indigenous people. Minnesota comes from the Dakota name for this region, Minnesota Makoche, the land where the water reflects the skies. We acknowledge the ongoing debt that is owed to the Dakota people and strive to create healthy dialogue, relationships, and practices that address this injustice, as well as others related to the indigenous people of this state. We highlight this fact because we recognize that the physical, virtual, and emotional space that we inhabit impacts how we do our work, and because the mission of public health naturally aligns with anti-oppression work. So after 2 years of pivoting and being flexible through changing guidelines, we are so excited to have you here, be here in person. And we're also welcoming some of our students online through a virtual webinar. We're hoping to make all these opportunities engagable and accessible as possible. So as with any transition, it will take us some time to settle in and find our own place in this new environment. And during this time, please know that your excitement and your trepidation is welcome. Your sweaty, itchy faces from steamy glasses from wearing masks is welcome. We welcome the distractions you may have if you're joining us online. We welcome you in your roles as students, parents, caretakers, change agents, and educators. Your quirks and your ambiguities are welcome. We welcome you at whatever level of mental and physical wellness you are currently functioning. We welcome your humor, and we welcome your silent contemplation. We welcome the parts of yourself that you're still figuring out. Your awkwardness is welcome. All ways of knowing, learning, and lived experience, and the many gifts you have to offer are welcome. I know many of you are eager to meet each other and want to begin to build connections, and I know you've taken some time to do that this morning in chatting with each other at your tables, and I hope that you are able to continue to do that today. We've been thoughtful in our approach to your orientation, carefully continuing with public health practices. Many of you have spent some time online in online orientation, which is so exciting. I love to see that. I hope that this resource has provided you a high-level overview of all that is available to you as you begin your program. That online orientation course will continue to be accessible to you throughout your time in SPH, so don't feel afraid to go back to that and look at different resources and refer to those things in the upcoming weeks. Based on feedback from last year, we also changed up the format of our program today to get you moving into some different breakout sessions, to provide you some different opportunities to connect with each other. Our goal today is to put a masked face to the many people who facilitate and provide those services that you learned about in online orientation. And so throughout today, you'll hear from a variety of university students and staff who are here to provide you the tools that you'll need to be successful here at the School of Public Health. Most of you will also have an academic level orientation this afternoon to learn more about the academic expectations, meet fellow classmates, and meet your faculty in your program. I encourage you to engage in all of the programming that's available to you and the many opportunities that will take place between today and the start of the semester. So here's our schedule for this morning. Interim Dean Bebe, Associate Dean Wattenberg, and DEI Director Lauren Jones are here to welcome you to the University of Minnesota and the School of Public Health. We will then break into smaller sessions so you can learn more about your public health career and hear from some current students who can give you insights into what it's like to be an SPH student. We will wrap up our morning with lunch, and you'll be on your way to your program orientation. Now I would like to introduce Interim Dean Tim Bebe. Dean Bebe has served in leadership roles at the school since 2016 and became our interim dean on February 1st of this past year. In this role, Tim provides collaborative leadership to maintain and advance the school as a premier leader in public health. In addition to his faculty and leadership roles in the school, Tim is the Deputy Director of the University of Minnesota Center for Learning Health System Sciences, Senior Advisor of the Community and Collaboration Program for the university's Clinical and Translational Sciences Institute, and a research affiliate and adjunct professor in the Department of Health Sciences Research at the Mayo Clinic. His teaching and research focus on survey methodology, patient-reported outcomes measurement, healthcare policy, healthcare access for vulnerable populations, and learning health sciences, health systems research. Please welcome Dean Bebe to the stage.
Well, that was a long-winded biography, so thank you for the nice introduction. Welcome, everybody. It's great to see everybody. Are you excited to be here? One loud yes, and I imagine that person speaks for all of you. So, summer lasts about 2 weeks in Minnesota, right? And so around this time of year, I get a little bit bummed out. The days are getting shorter. It's darker in the morning when I walk the dog, and it's dark when I walk the dog at night. But I'm always buoyed by the fact that, I get to meet the incoming students. It's actually one of my favorite parts of this job to see you all here, and it's wonderful to see you all in 3 dimensions. So, and for everybody joining virtually. So, welcome to today's event, and welcome to the University of Minnesota. So, it's my pleasure to serve in the capacity of interim dean and welcome you today. I want to thank you all for selecting the University of Minnesota. I'm sure you had multiple different options, and you chose the University of Minnesota for multiple reasons, and you definitely made the right choice, I have to say. So let me see if I can manage this. All right, so you're joining a university and a state, I would argue, that has been a national leader in public health since the beginning. The teaching of public health in the U.S. universities began right here on this campus 150 years ago with this guy. This is Dr. Charles Hewitt, a Civil War surgeon. He became the first professor of public health and taught the first course in 1872, the first person to work in that space in the country. Let's see here. So he was a true leader in the field of that day. He was a founding member of the American Public Health Association and served as its president in 1888. By the way, he's not alive anymore. He studied with 2 Nobel Prize winners, Louis Pasteur and Robert Koch, one of the founders of bacteriology, bringing their vaccine technology to Minnesota. He also crafted the legislation establishing a board of health in Minnesota, the 3rd in this nation, and served as its first secretary. And if that wasn't enough, he built the state's first disease surveillance system utilizing local physicians and the telegraph technology of the day. It serves as a framework for the surveillance system that exists currently. So the university founded our school in 1944 with a major endowment from Drs. Will and Charlie Mayo of Mayo Clinic fame. Gaylord Anderson was named, let me just forward this. It's hard for me to multitask. Gaylord Anderson was named its first dean through the Student Health Services Director, Dr. Ruth Boynton, served as in his stead while he was serving in the Army Medical Corps during World War II. You'll recognize the Boynton name if you partake in some of the services offered by Boynton Health. Dr. Anderson served as the president of the American Public Health Association, helped establish the Graduate School of Public Health at the National Seoul University, and received APHA's Sedgwick Medal for Lifetime Achievement in Public Health. So that's a hard dean to follow. So much more happened in the life of the school since its founding 78 years ago. There are so many firsts, major accomplishments, and strong leadership in public health in all these years. I encourage you to go to our website and under the About, under this SPH website, look under History, and it kind of chronicles all the firsts that were observed and instigated by the School of Public Health. A lot of milestones there. It's really kind of fun to look at. So you're joining a school with a unique point in its history, and in fact, the history of the planet itself. 3 public health crises, the COVID-19, structural racism, and the climate change are among the most critical health challenges of this century and the century to come. These and many other forces will shape your future and the future of our world and our school. So I just want to shift gears a little bit and talk about some of the information that you all provided. So in the next few slides, I want to talk a little bit about information you provided on like why you chose the University of Minnesota and the School of Public Health. So if you recall, when you registered, you filled out a survey, many of you. Thanks for taking the time to do that. These are the results that you offered to in response to one question. What were the top reasons you chose the University of Minnesota School of Public Health? So I'm just going to run through some of these. So the top reason, 80% of you cited the reputation of the University of Minnesota and the School of Public Health as one of the top reasons you chose our school. You're coming to a university that's committed to improving the human condition, and you're coming to a school that is known for tackling the most pressing health challenges alongside our community partners. Our belief is that everyone has a right to a healthy life. It drives our work relentlessly for the billions of people all over the world in need of better health and well-being. Our global impact has positioned us, as you look on the right-hand side, we're in the top 5% of all schools of public health and programs of public health. There's about 230 schools and programs in the country, and that list is growing yearly. We're ranked the number 6 public school of public health, and we're also number 6 in NIH funding in all schools of public health, and we have the second largest research portfolio here at the university. This all adds up to providing you one of the best educational experiences in the nation. So, second, 61% of you, about 2/3 of you, identified degree program reputation as a drive of your decision making. In addition to being a top-ranked school, our deep 78-year history has given us the foundation to establish a highly innovative program, some of which are the first of their kind in the country. Our Master of Health Administration, or MHA program, the first in the nation, is ranked number 2 in the country, and our biostatistics program is ranked number 9. We led the country in developing at the epidemiology PhD and the maternal child health MPH. The latter degree was just cited as one of the best, most well-regarded maternal health research programs by Bloomberg News. And just a couple of years ago, we began offering the first American Indian Public Health and Wellness Certificate. Through our highly regarded degree programs, we give you the freedom to explore the complex and far-reaching field of public health and provide the comprehensive skills and training required to create large-scale change. Location. Over half of you said that you chose the school because of the location in the Twin Cities. And I have to say, I agree, I love the Twin Cities. It's my favorite place. Minneapolis more than St. Paul, but they're both good. So there's much to enjoy about learning in Minnesota. If you like to bike, you're in luck. You'll be thrilled to know that we have, just in Minneapolis alone, 120 miles of bike trails, and it makes one of the most bike-friendly environments in the country. Interestingly, we're number 2 in bike ridership in the country, followed by Portland, and you'd think, given that we get down to like 30 below zero, that we wouldn't hold that position, but we do. I see people riding all winter long. Our park systems are consistently cited as the best in the nation. Minnesota is currently 7th in the U.S. in the state health rankings, and SPH, I would argue, plays a significant role in that, placing our state in the top tier. However, we all must acknowledge, in our state we grapple with conflicting truths, that while we might be one of the healthiest states in the country, there are huge disparities. We also have some of the biggest disparities in the country as well. It's a great place to live if you're white, not so much if you're black or American Indian. In 2021, we launched the Center for Anti-Racism Research for Healthequity that'll help our state close the quality life gap and ensure that all people have the support and resources needed to reach their full health potential. Okay, so a lot of you mentioned faculty as a reason why you came, and I couldn't say it strongly enough that your assessment of our faculty is spot on. The heart of our scientific enterprise is our faculty. They ask the critical questions, mount the studies, make discoveries, and translate them into action, and they're also master educators. At Minnesota, you'll learn from some of the foremost thought leaders in their respective fields, people who continuously shape the way public health is practiced around the globe. They will push you to do exceptional work, offer you real-world research and leadership experiences, and prepare you to work alongside others to create change. About a fifth of you identified our commitment to anti-racism as playing a role in your decision-making. The most far-reaching and powerful influence on the social determinants of health has always been racism. Myriad data points and personal stories prove the damage racism does to health as it infiltrates every structure and system in our country. The simple truth is that our society prioritizes white people, and that means the health of everyone else suffers. To live up to our school's guiding value that health is a human right, we have a responsibility to expose and dismantle racism's influence wherever it is, including our own school. 1 year ago, we launched a strategic plan for anti-racism. This 5-year plan is a detailed roadmap to keep us on track in making diversity, equity, inclusion, and justice central to our operations and our mission. Over the past year, we've made important progress toward this goal. You can see some of this, the progress depicted on the rightmost panel of this slide. But I also recognize there's an incredible amount of work to do in front of us. I ask you to become part of this effort by living its theme: to commit, to challenge, and to change. To commit by prioritizing anti-racism, racist efforts and making the school a more welcome, equitable, and just organization. Challenge racism by asking hard questions, grappling with multiple truths, and challenging racism when you see it. To change, we have to be willing to shift our beliefs, attitudes, and actions toward equity and justice. The world has never needed public health experts more than it needs it right now. We've kind of been historically known as the invisible guardians. It's hard to talk about the disease you didn't get because of our efforts, but the last few years have shown our centrality and importance in tackling some of the most challenging problems facing our country and the world. So our school is driven and guided by the belief that health is a human right. And we're grateful that you are joining us in making that belief a reality. We're proud to play a part in shaping generations of public health leaders. We train about 2/3 of all the public health professionals in this state, and that's just the state. So we want to prepare you to be ready for the challenges and foresee. We can't foresee now or define. This year is the beginning of an exciting transition for you and our school as we welcome you to our new class. You bring unique talents and gifts, and we are honored to be partnered with you in this new adventure. Welcome to each and every one of you in our entering class of 2022. It's wonderful to have you here, and I hope you enjoy the day. Now we'll go to the main act. I'm the warm-up band. I want to introduce Betsy Wattenberg, who is our Associate Dean for Education and Student Engagement and Professor in the Division of Environmental Health Sciences. Betsy's been involved in public health education for many years, teaching and advising SPH students and directing MPH, MS, and PhD programs. Please help me welcome Betsy Wattenberg to the stage.
Thank you, Dean Bebe. So good morning. I'm Betsy Wattenberg, Associate Dean for Education and Student Engagement. And on behalf of our faculty and staff in the School of Public Health, I'm excited to welcome you here. As Associate Dean, I oversee all the educational programs in the school. So my job is to make sure you get a great education and that you get all the support you need to be successful. So our goal is to provide you with the knowledge, skills, and experiences you need to become leaders in public health practice and research. You learn from the experts. Our faculty are leaders in cutting-edge research, and they're also dedicated to serving the community and making the world a better place. What's most important for graduate and professional education is that you'll have opportunities to apply what you learn in the classroom to research and real-world practice experiences. We use an external review process, accreditation, to make sure we deliver high-quality public health education. So in fact, we went through the reaccreditation process during the past year. In April, we had a site visit from a review team from the national body that accredits schools of public health, called the Council for Education and Public Health. And it was a great opportunity for us to show off the strengths of our educational programs, but also to reflect on how we can continue to improve. I have to say it was very gratifying because the site committee was really impressed with the school. Another important part of high-quality education, as Tim Bebe mentioned, is addressing diversity, equity, and inclusion. So we're all really proud of the strategic plan for anti-racism and excited about starting the second year of this really wonderful strategic plan. And during the next year, what we'll be doing as part of this is develop the educational goals of the strategic plan. So I'm really eager to hear from you about what makes education meaningful for you. So to sum up, I encourage you to make the most of your time in the School of Public Health, engage in learning, ask questions, let curiosity drive your exploration, and also make connections, get to know the faculty, your classmates, attend your program level orientation this afternoon, get to know alumni through the mentor program. So thanks for choosing the University of Minnesota School of Public Health. Have a great start to the school year. And what I'd like to do now is welcome our Lauren Jones, who's our Director of Diversity, Equity, and Inclusion.
Good morning. I recognize that that picture is old and that I cut my hair about 6-7 weeks ago, but I'm on it. Thank you all. So thank you and good morning. Thank you, Dr. Weidenberg, for your introduction. My name is Lauren Jones. I use she, her pronouns, and I'm the Director of Diversity, Equity, and Inclusion here at the School of Public Health. We have a team of 3 that do this work full time, but we invite everyone in the school, in the community, to learn and support the work of anti-racism, equity, and justice. Gail Smaller Jr. is our Associate Director, and Andrea Perez Maicula serves as our Program Director. Our shared office is currently in the Dean's Suite, but if you're interested and you want to talk to us, it would be easier to reach out via email. Sorry. All right. So in July 2022, as Dean Bebe mentioned, the school launched the Strategic Plan for Anti-Racism, affectionately named SPAR, which I hope you've heard about by now. We've been working hard as a school community to identify and eradicate systemic oppression within the school, from our recruitment and hiring practices to our training events, research, and all of the other work that we've been doing. We have lots of work to do, and we're excited to partner with all of you to advance our goals in this area. So what can I do? What can all of you do? As a student, we have a number of ways for you to get engaged in the strategic plan. You'll receive invitations, announcements, and newsletters about this. In a few weeks, we will be conducting our second climate assessment for the school. We ask that you participate in the survey so that we can accurately gauge how effective our efforts have been. Aside from that, you can get into your classes, reflect on how you can use the lens of anti-racism and anti-oppression in your reading, research, applied practice, and class discussions. I wanted to highlight a couple of events that are coming up for you to look forward to. Our Justice in Public Health series will feature monthly virtual guest speakers and covers topics of public health that align with our SPAR goals, such as reproductive justice, critical race theory, and disability rights. We will be hosting a BIPOC student reception in the new Health Sciences Education Center, also called HSEC. Let me back up for a second. When I say BIPOC, that stands for Black, Indigenous, and People of Color. And so I want to make sure I'm pointing out our acronyms, because we use a lot here. On Friday, September 23rd, is the BIPOC student reception. I hope to see many of you there. We also have some exciting workshops and leadership opportunities that I hope you will be able to participate in, so those will be opening up soon. You can stay abreast of our events and opportunities by visiting our website and through our monthly newsletter, Notes on Anti-Racism, Justice, and Equity. Yeah. Okay. There we go. Lastly, we manage listservs for our Black and BIPOC students within SPH. If you would like to connect with other BIPOC students and stay in the loop, please complete the form at the Z link provided on the slide to be added to one or both of the listservs. General questions and feedback can be sent to any of us, anyone on my team. I'm personally invested in the success of every student here and open to answer questions and have lots of conversations with you all. I hope you have a good rest of your day, and cheers to a new school year.
All right. I know our clicker is not behaving. Well, maybe there it goes. All right. Well, I want to thank Dean Bebe, Associate Dean Wattenberg, and Director Lauren Jones for joining us today and providing a strong foundation to the School of Public Health, your education experience. And just a great welcome. Thank you so much. We are going to now transition to our breakout sessions. One will focus on your public health career, and the other will focus on what it's like to be a student here in the School of Public Health. These sessions are designed to provide you a chance to get up and moving, because I know you've been sitting for a little while, meet some other new students, and learn about the resources that are available to you to support you this year. You're going to have the opportunity to attend both sessions, and so we're going to do half of you are going to move to another room, and then we're going to swap at 11:15. So here are the directions. If you have an A, raise your hand if you have an A on your name tag. Okay, you all are going to stay in this room, and so you can stay here. You'll be attending your public health career session with Vic Masalia, the director of our Career and Professional Development Center, and that'll be starting in just a few minutes. Now raise your hand if you have a B on your name tag. Okay, you all are going to move, and there's a room right behind you. Kaelin Ammak, who is our Student Senate President, and our two student panelists are excited to join you into the SPH room located behind you. Those sessions are going to start right around 10:30, so feel free, if you have a B on your name tag, feel free to stand up and head back to the other room, and we'll be getting started shortly here with those breakout sessions. No, it's supposed to start right now, so.
Welcome back. It's so great to see you. I'm Vic Masalia. I'm the director of the Career and Professional Development Center. I go by he and him and his pronouns. I'm ecstatic. It's one of my favorite times of the year. Also, I have the best job ever, so every day is a great day. I'm originally from Rochester, Minnesota. I was in the Air Force for about 9 years in personnel, helping people through transition. I worked at the law school as a career counselor for 9 years, and I've been here for about 7 years, and all that time in a career development position helping people through. My colleague, Darren Kaltfed, also uses he and him pronouns, unable to join us today. He's out ill, so let's send him some healing vibes. He's an extrovert like I am, so he really would want to be here. But he was at the College for Science and Engineering for about 6 years, and he's been at the School of Public Health for 11 years. And the two of us make up the Career Center. Today, I'm going to talk about big picture, what's public health? Some of people are still asking, what's public health? Oh, you're going to get a public health degree. Well, what's that? And so that phrase, those two words, are meaningful to different people. Some people are still trying to figure it out. And I'm just going to share some different perspectives because it's not just one thing, as you know. In fact, when I worked at the law school, they were wondering why they would have a career counselor at the law school. Don't they know they want to be lawyers? Well, like law, that has many, many fields, so does public health. Okay. Knowing the reality. So as a career counselor, early in my career, used to work with people on what do they want to be when you grow up. Didn't you hate that question? Hey, what do you want to be when you grow up? When I was a little kid, I wanted to be a bird. Okay. I wanted to fly. So what you want to be is a destination, right? And so throughout my studies and learning more about career development, I think it's just the wrong question. It's who do you want to be? Who do you want to be? What am I becoming? Gandhi said, be the change you want to see in the world. So what am I going to be? What type of changes do I want to make? And what environment in the world do I want to make those changes? And here at the School of Public Health, we want to help you become the person that you want to be. And public health is a part of your development, your personal and professional development. And so I'm going to talk a little bit about trends from a macro viewpoint. We'll talk a little bit about industry. We're going to talk about some placement figures and what people go into, and then I'm going to give you some suggestions on how you might want to approach this journey. We have a session on career tomorrow, and there's one on applied practice tomorrow as well. If you can join us, I'll have more details on a slide coming up. But what is public health? So I'm just going to say here are just a couple vantage points of what public health could be. Public health comprises competencies and functions and some essential services that they provide. On the right, can anybody name what that model is? Does it look familiar to anybody? It's the Minnesota model. Okay, so that's going to come into your purview very shortly. And so that on the left-hand side, if you can't read the little pie pieces there too, comprises some elements of what public health does. Another vantage point of looking at is like, what is public health regarding where? Where and what is public health? Right now, we just picked a domain. We put government, and it's a system. Public health is a systemic process of change. Okay, I just put 3 entities on here regarding the Minnesota Department of Health, the CDC, and in the global aspect, the WHO. Well, Vic, what else is public health? Well, I'll tell you, it can be a set of beliefs as well. As Dean Bebe said, you know, public health is a right. It's a human right. It's a set of beliefs. It's about doing good for the herd, sometimes at the expense of the individual. Also, from a preventive measurement, you know, obviously we want to fix problems when they happen, but there's this metaphor of trying to fix things upriver before they occur, before the stuff flows down the river. So can we go upriver to prevent some of these things? What is public health regarding a career? And I'll tell you, in the years that I've been here, it's a fantastic career. Many, many options. I'm going to show you some employment figures for sure. But as you know, probably pre-pandemic, people didn't know what public health was, even to a greater extent. And like, oh, okay, wait a minute. We know what public health is, thanks to the pandemic, obviously, and racism as a public health issue, as gun violence occurs too, and what are different ways that we can approach that. But many of you have varied backgrounds, and I've talked to a couple students even today. It was like, you know, I'm coming from an English background. I'm really kind of stressed about this. You know, what you're bringing to this profession is equally as important as what you're going to get, because we all have to bring these different perspectives into the profession. There are just a myriad of ways to go about public health. Your job is to figure out what skills do you want to develop and where do you want to apply those skills. So your faculty, colleagues, the Career Center are all in it to help you get through that process. And also there's domains. We do, I'm going to share a slide in a moment here, like where do people go regarding industry, public, private. So when you're applying for schools, now I told you I worked at the law school, and placement was really placement figures. Like, I want to go to law school. Am I going to get a job in 3 years? Law school's 3 years. Here, most of you are in a 2-year program. Some of you are on a 3-year program or part-time, and some of you are pursuing a PhD. You're all welcome. So, want to keep in mind, I mean, we have really good employment figures. Something that we can be, as a school, very proud of. However, my thought here, it's a very individual thing. Okay, my goal for all of you is to find work that you find meaningful, fulfilling, and that you're making a difference. You know, working at in a fast food place, those numbers aren't included here. So these are folks that are working in public health related positions. Not discrediting that, but you're going here for a public health degree. My role for you is to find work that you feel a part of, that you feel that you belong and that you fit in, and that you are growing your skill set. Okay, so you'll see within a year, you know, we're sitting at like 99%. Okay, the earlier you think about this, so see that first upon graduation, that 87%. What happens typically are the 13% that don't have the opportunity, their stress level is this high, okay? Or some folks that don't have opportunities at that time. Well, most people that have an opportunity are pretty vocal about it, and so that you might have heard at the end of your undergrad experience, like, everybody has a job except me. Well, the folks that don't have opportunities aren't the ones that are sharing it. So just for perspective there. Where are our graduates? Okay, this is hard to read. They'll be available and are available on our website, but I just want to share some of this information. Does this have a laser? Oh, I think they can't trust me with the laser. Maybe take an eye out. Anyway, some of this, our employment rate upon graduation, we talked about. The industry factors here, that's the color. This is percent by industry. Healthcare is about 39%, government 25, so 1 in 4 are going to government positions. About 15% stay in academia, for private practice, 13%, and finally 10% in nonprofit. That's kind of, if you're working for a hospital, that could be a nonprofit, and it could be at times healthcare. So some of those figures might be blended together. Salaries just on average $76,000, and some of the top employers where our students go. The state of Minnesota is our number 1 employer. Hennepin County, Department of Transportation, Health, and Children's Minnesota Health Partners. Okay. So what do our students and graduates do? Again, a difficult one here to look at. Perhaps you can see it. So the colors here, the maroon is healthcare, yellow is government, education's blue, private practice is green, nonprofit orange, and self-employed is, I think it's black. What you can see here though, most of our students have landed in some type of administrative role. Next, in data analysis. And thirdly, health disparities. Okay. The thing about public health too is a lot of these things intersect on what people do. Okay. All right. So, thinking about your career, the best way to predict the future is to invent it. This suggests that the best way to know what's coming is to put yourself in charge of creating the situation you want. I apologize for stumbling. Half of my slide is cut off. So I have to find my place here. So just this idea of being proactive here. As a career development professional, we have some methodology that we think through as you are learning methodologies and processes to work through a process. I'm not going to go through all of these, but just thinking about self-awareness is a great place to start. I'm going to have a little example here in a couple slides. But thinking about why am I here? What brings me here? Okay, that can be done through self-assessment, 360 evaluations, meaning you're collecting information from others and figuring out what brings you here at the School of Public Health. When you're interviewing for an employer, employers are typically really interested in, if we're doing interview prep, they're interested in these 3 things. One is, do you have the skills, abilities, talents, competencies to do this work? And they're going to want some specific examples. They want to know if you're able to grow and do you have the potential in those areas. Another area that employers want to know about is, do you fit? Are you going to be one of us? And oftentimes we don't know if they want another extrovert or another process-oriented person or somebody can work very independently and alone, because we don't know what a team is, right? Sometimes you'll figure that out in the interview, but hopefully you'll know that before going in. But what's it like to work with you, okay? What are your values? What are you interested in? And that will come out in the interview. And then thirdly, which is really important, talking to employers over the years, one of the frequent feedbacks we get when we ask, how can we best develop our students? What are we missing? Vic, you have to help your students answer the question, what do you know about us? It sounds like a simple question to address, but they wouldn't be bringing it to me if they didn't think it was an issue. Or, why do they want to be here? Why do they want to work for us? It's incredibly important to be able to articulate that. So, starting off here, first day, orientation, just thinking about those 3 areas. Okay, maybe I'm going to do a skill assessment on what has brought me here. Can I articulate what my values are? Or, hey, what's it like to work with you? And finally, where do I want to work? Okay, you don't have to have that answer here, because this is a journey. Again, remember, who am I becoming? Becoming a public health professional. To help you with this, the Career Center, we offer some competencies. We organize them in a couple different ways. One, on the left-hand side of the slide, are the career development specific competencies that we can help support you. As I mentioned, I won't read all these to you, but some of the most frequent ones we get is resume development, cover letters. What's the difference between a resume and a CV? There's a rumor out there that says that resumes have to be one page. They say it has to be one page, and I'm still looking for that office of they. Where is this they? Who are they? You know, who says that? So I'd love to talk to you about that. Get really excited about that question. Interviews, probably the second. How to network, third. Job search strategy is probably the fourth element of most frequent things we talk about. Also, any obstacles? You know, I had this interview. Can you kind of talk me through it? Talking about professional development on the right-hand side is a different but similar set of competencies. So either Darren or myself will be able to provide counsel or refer you to some areas of need on the right-hand side. And this is going to be like communication skills. I'm going to a conference. How can I best maximize my experience at the conference? I'm more of a shy person, more on the introverted side, and I heard that success is all about relationships. How can I develop my relationship skills and acumen? Networking is a scary word. However, if you frame it in like, who's my future colleagues, who am I going to be working with, it might change that dynamic. And that what I would say is the most important thing that you might want to explore from day one. Get to know each other, your faculty, and who's doing the work that you want to do. All right. So we had this at the table, and this is the Mph Roadmap. We're going to be posting the PhD in an MS Roadmap. Oh, I had them in the back at the resource fair, but it's also online. We have an electronic version that has links in it, and this will help. What do I want? Should be doing this semester, next semester for your 2-year program. So watch out for that. Okay. So now I'd like to ask you to reflect for just a minute. Anybody familiar with Simon Sinek? Anybody else? You? 2? 3? Kind of, maybe you've heard the name, Anyway, he has like one of the top 5 TED Talks. If you want to see it, it's called Start With Why. Start With Why. And on the upper right-hand corner, you can see this model, okay? And so what happens here is that he gives some examples in this TED Talk about IBM. He said, you know, computers are computers, and on the outside, people are looking at some of the features of a computer, but people don't buy what you put together, they buy why you do it. And so he uses Apple, for example. Why would you buy an Apple product? What comes to mind when you think of Apple? You can think about their products, you know, the watches and the iBooks. However, it's an innovation, typically. You know, Steve Jobs says, I want to put a ding into the universe, okay? So people buy why they're together rather than what they do. And that's what I offer you. It's like, why should I hire you? On the outside, you're gaining all these skills, abilities, and talents, but thinking about what drives you from the inside is really what's going to matter. For those tough times, studying is difficult, it's been a long week, can't do another thing. If you revisit this purpose or why statement, it's going to help you get through that. Okay? And here's just some questions on how to help you get through that. And so what I'm going to invite that you do on your phone, write it down, is to put together a why statement or a purpose statement. And this could be for your life, or it could even be for public health. So I'm going to put context. This is in 2 parts. Okay, I get up in the morning too. I get up in the morning too. This is my reason. This is why I exist. This is what my goal is. And then the second part of that is impact. I'm here to do this thing so that. And so I'll give you mine, you know. And it took me a while to figure this out. I had to play, I had to reflect, I had to ask others. But I'm here, the theme in my introduction was about transition, okay? And so I get up in the morning to help people through transformation and transitions. I get to do that. I think of myself as I get to help the helpers. So I get up in the morning so I can help people through transition. Now this might sound like I'm on a beauty pageant, but it's true. It's so we can make a better world. So I can make a positive impact. And that's big. So that's why I'm hoping working with all of you individually now is to help you through, get from here to there, remove obstacles so you can be as successful as you can, and help with these huge, huge issues. So, just want you to take a minute or two, jot down a couple notes, and then if you would, just talk to the person next to you to see kind of what'd you get, okay? Give you maybe 3.5 minutes. Raise your hand if you have the right answer. What'd you get? Well, maybe you're not ready to share. I know it's personal. But thinking about this from the inside out, starting with why. You know, oftentimes at a networking session, they, probably are accustomed to being trained to have an elevator pitch. How many people know of an elevator pitch and what that is? Oh, I see some really unhappy faces too. Oh, the elevator pitch. For those that don't know what an elevator pitch is, so an event like this, or like you're meeting a job, or you're at a job fair, or a networking event, they're like, have your elevator pitch. And what an elevator pitch is, the mindset that time-wise, when I'm introducing myself, by the time it takes me to get on an elevator and go up the floor, I'd be able to tell you where I'm from, who I am, what I'm interested in. What's the problem with an elevator pitch? Anybody? It doesn't sound consensual, right? Hey, we're stuck in this elevator, or like I'm meeting you and it's going to be all about me. Me. And it's just so forced, right? And so as a career counselor, I'm not a big advocate of having an elevator pitch in an event like this. However, when would you use an elevator pitch? When you want to talk about yourself. And it's typically the first question in an interview. And most, again, this is something other people hate, a lot of people hate too. What's the first question in an interview typically? Hi, Vic. Tell me a little bit about yourself. Oh, I'm supposed to have an elevator pitch. Yes, that's an invitation. That's consensual. Thank you for that phrase, by the way. That's awesome. So when you're at a networking event, you want to be normal, if you will. It's going to be like, have a conversation, pass the mic every now and then, and be curious of the other person. And so coming out with a why statement is also good. You know, hi, I'm Vic Masalia. I'm the director of the Career Center. I'm helping people through transition to do really great public health work. How about you? What's your name? What do you do? And so that's the development of having a conversation at these type of events. So what I'm going to ask you to do, so you don't have to share your why statement, but I would like to ask you to introduce, if there's somebody, you might have to get up and walk over to somebody, but introduce yourself to somebody with your name, where you're from, and what your program is. And that, just those three things, okay? On your mark. And so one person's going to introduce one person to the other and to the other person, okay? You ready? You can do that. If you want to accidentally throw in your why statement, you can do that too, okay? All right, ready, set, no elevator pitch. Just introduce yourself. Okay, go. How's it going?
I was talking over you, sorry. Is it break and then reconvene for more presentation, or then anything is switched?
I'm going to wrap up.
Okay.
And then...
Got it. Sounds good. I'm Chris, by the way.
I'm good. Nice to meet you.
Vic. Yeah, Vic. Nice to meet you. Yeah, I'm the new photo video for the school. So,
Fantastic.
just seeing
Welcome.
Absolutely. Thanks.
I work in the Career Center.
Career Center. Very cool. I'll see you there.
Okay. All right. This is a good problem to have, I think. It's a really good problem to have when you can continue to talk. Any why statements out there? Okay, Okay, all right. Next time, maybe. So there's a lot going on, as you can tell, orientation. So a little bit more about the Career Center. I know what's coming up here. Oh yeah, I did change some slides around. They're different than here. I'm a last minute changing slides person. So for the Career Center to interact with us, we have drop-in hours. They're all virtual. We're going to be on Mondays. I think that's going to be Wednesdays. That's a mistype from me. Wednesdays and Thursdays. There's the URL there. This is on our website. So if you go to our website, feel free to email us. And then Darren's been here for 11 years. I've been here for 7. LinkedIn is a very, very positive tool. Okay? Hey, where are our alumni going? LinkedIn is a fantastic tool to use. And if you want to learn more how to use that, feel free to contact us. We'll have some presentations coming up talking about various networking opportunities. Connect with us on LinkedIn. Okay? Tomorrow, let's see, too fast. Tomorrow we're hosting a session that we're going to go a little bit deeper at 11:15. We're going to be talking a little bit more about resumes, how to put together the best resume. I would consider putting a resume together just in case somebody's asking you for it right away. You might have had a resume to apply for the school too. If you go to our website though, on the resume page, we have a couple examples on how we might want to ask you to format it. So make it look like that. But we also are going to have some workshops, all virtual. We'll host them on Fridays at noon on resumes. That'll include cover letters and CVs. We're going to have how to interview. Interviewing is a skill, okay? So is networking. We want to make sure that we can help you with those as well. Also tomorrow, for those that are pursuing an MPH, we're going to have a session tomorrow on applied practice. And I want to introduce my colleague, who's going to be talking about that tomorrow in depth. And Mercedes knows everything about it, so she's your go-to person for that. Okay, she knows more than everything. She's disagreeing with me. Also tomorrow at the session, we're going to talk about the Minnesota Prepared Internship program that's fairly new here, and Kenzie will be there to talk about that as well. Also, I want to just highlight too, on October 6th, Mercedes putting together this amazing practice day session. So just get that on your calendar. Earlier is better than later. All right. And as I mentioned, you'll learn more about this tomorrow. Go to the session. All right. So I walked around with Dan. Thank you, Dan. And we put these mentorship program cards on your table. I really want to plead with you. First of all, if you're interested in the mentorship program, and if you're not interested in the mentorship program, I want everybody to sign up for the mentorship program, and I'd love to ask you to do it sooner than later. I talked to the coordinator who's managing that program, and I said, hey, what would you want me to say? She said, sign up immediately. What happens oftentimes is that in mentorship programs nationally, I've managed a couple, folks will sign up at the last minute. Well, recruiting of mentors is incumbent on how many mentees. And so what typically happens in these programs is like, I think maybe kind of, okay, I'm going to sign up the day before. Well, they already have a finite number at that time to recruit mentors. So I'm asking, again, for even those who aren't interested in the mentorship program, I'm going to encourage you that you sign up. It's one of the most popular mentorship programs in the country. I'll be happy to talk to you why you'd want to have a mentor and have that experience. It's been an amazing program, and perhaps it will be for you. So please sign up during lunch today. If you have to sign up at the last minute, I totally understand, but better to sign up early. Okay. All right, I've got 3 minutes left. Any general questions that I can ask or answer? You're going to come to my session tomorrow, right? You're going to go to Mercedes as well, but anything? Way in the back. I should have mic'd you up because I heard 3 words. Does anybody up here translate that?
I'll use my projection.
Oh, I can hear you just great.
Can we choose our mentors, or do those have to be chosen for?
Oh, thank you for that question. That's a great question. So that, again, that's incumbent on signing up early. You get matched. So the mentors have been asked, what program did you graduate from? What's your area of interest and study? Where do you work? Where are you geographically? Do you want to meet online or do you want to meet in person? There's some identity features in there. And students, you'll do the same thing. The best that they can do, they manually match that, based on this, criteria and this criteria, we're going to do the best that we can to match you. So some matches, just anything's organic, so they just trust the process, though, okay, that they're doing the best you can. Thank you. That's a fantastic question. Yes, sir. If you already have a mentor, can you? I'm sorry. Oh, if you know somebody? Do you have a mentor? Yes, absolutely. If you know somebody who can be a mentor, go ahead and ask them and invite them to be in the program as well. So, we just have an official mentorship program to make it easy to match you with a professional. If you can get a mentor on your own as well, I think that's okay, and that's great. Okay, so yes. Okay. And I'm getting the wave to get out of here. I hope you can come to our session tomorrow. Thank you so much for your patience. Welcome to the School of Public Health. Enjoy the school panel, the student panel, and take care. See you at lunch. Oh, yeah. We can, yeah, we can, absolutely, and your faculty for sure, and your advisor, but yeah, we take a team approach, so absolutely. You're welcome. Oh, I didn't know.
They're about to dismiss everybody.
Great. That's fantastic. Okay. It's nice to meet you. Yeah, likewise.
I just wanted to make some connections, especially since you were sitting right up here.
Are you comfortable?
Yeah.
Kind of, although we were about to say we feel exposed.
Do you?
But it's okay.
Not in a bad
Not in a bad way.
You guys got to get your
We
song
had
and
like
dance
a
number.
blanket
Why didn't we have
Right.
a dance?
I'm so glad that everything worked out.
You should have come up with something.
Yeah, I was kind of struggle at the end.
I know what the
That's okay. No, that's okay.
your wedding.
I'm just happy you could actually show up. I feel like that happened with a ton of international students and they couldn't get their visa.
I have the memory of
It's a big thing. I'm really glad that you're actually here. Yeah. Yes. Yes. Yeah. Yeah, totally. Yes. Yes.
So,
We'll be doing our
yeah, I'm trying to figure it out. And it's like,
Yes, it's good. I thought you were just talking. Okay, all right. But no, the first one was yes. First one was fabulous. This one will be seriously.
Yeah.
yeah, I was kind of
So it was wise.
actually, I just think
That was
my sister's wedding this weekend.
So what are you doing this?
Yeah. The wedding was
okay. This is being recorded at my church.
a long time ago. Yeah, and that was in like child sight. That was child sight. Yeah, yeah. Different. So, how about yourself? Oh, really? Okay. All right. Yeah, Where did you go? Where did you go? Because I think for being assumption, I wouldn't have known where any idea you were.
It's like comfort level around study. You give a green, you can like not talk to you. If you have a yellow,
Maybe for PhD.
I don't know what I was. There was a lot of like, but it was like this PhD and movie schools like there were no there was no secrets. There was no
Good morning. It is 11:15, so we're going to get started. Can you all close your eyes and not look while I go back in my slideshow, please? Thank you. Okay, awesome. Welcome, welcome. This is our second breakout session, being a School of Public Health student. I am so excited to see you all here. So excited to have you all as brand new students here at the School of Public Health. This is super exciting. My name is Kaelin Ammak. that's me. This is what I look like if you met me earlier at the resource fair. Here I am. I am our School of Public Health Student Senate President. I am a returning maternal and child health MPH student. And I'm super excited to be here and kind of host our little panel discussion. So, this is a really fun graph to look at, but this is kind of a collection of the top concerns that you all indicated on those RSVP forms you filled out for orientation. I'm not going to go through them all, but the main point of this is just to show you that if you are worried about something, you are not the only one worried about something. We're all kind of going through it together. You're all new students. You're all worrying about a lot, and I totally get it. Bob and I were in your shoes 1 year ago. But with all of that said, we're going to do our best to kind of address as many of these as we can. There is one on there about a career, and you all just heard from Vic, who can talk better about a public health career than I could ever hope to. So with that, I'm going to let our fabulous student panel introduce themselves.
We're fabulous this time. That's
Yes.
exciting. We were astounding or something last time, so that's phenomenal. Thank you. Hi, everyone. My name's Bob Liebel. I'll use he, him, his pronouns. If you call me Robert, I'll think I'm in trouble, but you're welcome to do so. I'm a returning student in the PHAP MPH program and really excited to be here.
Hi, everybody. My name is Madura Vashon. I use she, her, hers pronouns, and I'm in my last year of the PhD program in the Division of Environmental Health Sciences. It's nice to meet you.
Awesome. So between the three of us, we have some masters, some PhD, and we span 3 different divisions. So hopefully we can kind of give you a good snapshot of what your experiences might be. Of course, we cannot speak on behalf of everyone, but we're going to do our best. So we're going to jump right in and get started and chat about getting involved as a student. So we're going to kind of chat about some of the things we are involved in and then how we have found those involvements and ways to get involved.
Awesome. I'll get started. So one of the first involvements I joined actually at orientation, so just a year ago, was the Health Equity Workgroup Student Subcommittee. So if you're at all interested in health equity work, there's a work group on campus through the school that does a variety of different subcommittees. So if you're a student, you could be on the subcommittee for students, or you can plan different events based off of the different committees, roles. There's also the big work group meetings, so you're welcome to attend those, see what's going on with the campus related to health equity work, as well as, community members who come to speak and all of those great things. It's all, everyone's going to say it a dozen times today. It's all in the Sphere. Read the Sphere. It's a newsletter that comes Monday morning. Give it a read. All of the opportunities to get involved are in there. Another opportunity, I don't know if I've worked with any of you, but I'm a ambassador in the admissions program. So if you're at all interested in helping students like yourselves join the program and go through the application admission process, talk to Joel and he'll be happy to get you involved with the program. It's a great group of students who just want to make sure everyone gets into the program who wants to be, and you get paid, which is always an exciting thing. The last thing I'll mention, I work with the Student Senate at the university level. Kaelin is at the SPH level, so I work very closely with the SPH Senate. I represent the School of Public Health at the university level. So if there's ever a concern that you have or something that's wrong with the university, of course bring it to Kaelin in the SPH Student Senate, but also pass along to me and I can bring it up through the university committees and all that good stuff. So anyway, read the Sphere, get involved. It's going to be amazing.
From the doctoral level perspective, I think it's okay if you're in a PhD program if you have a little bit more of a specialized goal in terms of the kind of job you want to get after you graduate or the kind of skills that you want to develop. And so I strongly suggest signing up for opportunities that are going to help you meet those goals. And so, for example, I joined the Infectious Disease Journal Club, and that was really great because you could meet with other people and go through peer-reviewed papers and analyze those, and that's a skill that I wanted to develop for myself. And so it's a little bit less about, joining as many organizations as possible and a little bit more about figuring out how you can help your career move forward.
Absolutely.
Yeah. Big surprise, I'm involved in Student Senate. And it is a great way to get involved at the university level. For many, if not all of our student organizations, you don't have to be an official member of anything to go to their events. And in this next month or so, there's going to be 1,000,001 welcome events for every organization. That is a great chance to go and just kind of see what they're about, meet the members, see if it's going to be a good fit with your interests, with your schedule. I'm also involved in the Maternal and Child Health Interest Group, which, as the name suggests, is kind of more specialized to the Maternal and Child Health program. I believe every program here is also going to have some sort of organization to that effect, and that can be a great way to meet your classmates and have some more events, activities, and advocacy around those specific program interests and goals. And then I know we talked about the sphere. You're also going to get emails from your division, your program coordinator, the university as a whole. Those are going to have probably like one thing happening rather than the sphere with the whole calendar of events for the week. But check your email, even if it sounds boring and lame. Like, check your email. There's going to be some fun stuff kind of hidden in there. Anything else with involvements? Awesome. So, kind of similar. We are going to jump into meeting people. There were a lot of questions, concerns about like, how am I going to make friends? How am I going to get to know people? We're going to kind of lump meeting peers and friends in with connecting with faculty and alumni as well. Those are like the three main groups of people you'll be around. All are super important. For some of the similar and some different reasons. That was a really weird sentence. So sorry. But you can connect with all of those people in different ways.
Yeah. So I said this before, but I came into this program with a lot of different things that I really wanted to learn, and the university is a great place because there are so many different faculty, not just in the School of Public Health, but outside the School of Public Health, that are readily available for students. I was really interested in learning things in the College of Veterinary Medicine and the Department of Applied Economics, and so I kind of just cold emailed all of the faculty that I was really interested in meeting with, and everybody gave me, a half hour, an hour of their time over Zoom to talk through the things that I was interested in, and I strongly encourage you to do that because you'll get the most out of the program if you take a lot of initiative and put inputs into the program and just reach out and keep asking.
Absolutely. I'll piggyback. If you go on the SPH website, you can go to the directory and search the different interests you might have, and then all of the faculty that have similar interests will populate. So if you have an interest in maternal and child health or infant health, you'll select that as a topic area, and all the faculty who do similar work in that area will pop up. You can read some of their journals. It'll have their email, sometimes even their office hours. Bug them. They're here to help you. They're here to help you learn and become the best student you can be. Another opportunity to engage with faculty and alumni is to start using your faculty advisor as soon as you can. It's their job to support you academically. So set up a meeting with them. Talk to them before you register, during registration, after you register. Ask them what type of faculty they would suggest connecting with based, off of your interest. They know the faculty way better than the website will know, and probably you will know at this point in your career. So utilize your faculty advisor. They know a lot, and they're here to help you. As for an alumni connection, there's an alumni mentorship program that you may or may not have heard about yet. But there's an application that gets sent around in the early fall. You can sign up for it. You're connected with an alumni that you kind of get to pick. There's a big list, and you rank them, top 5 or whatever it is. And then you connect with them. You can meet with them bi-weekly. You can meet with them every other, month or semester. It's kind of based off of what the two of you can manage. And it's a great opportunity to meet with someone who might have been in the very program you're in, ask questions about what classes they took and how they, persevered through different assignments, all of those good things. To transition into meeting friends and peers in grad school, I'll tell kind of a corny story that I'm sure Kaelin is very tired of hearing. But I would suggest on your first day of class in a couple Tuesdays, get to class about a half hour early. When you start seeing students appearing, just searching for that course or that class number that you need to be in, help them, because you might have discovered it all of 2 minutes earlier. And then after class, plan to stay for lunch, because it'll probably be around the lunch hour. If you haven't yet been in Moose Tower, find the Caribou in Moose Tower. It's right at the entrance. Plan to eat lunch there the first couple weeks. It's more likely than not that some of your classmates will also eat lunch there. You'll get to know each other. You'll meet other people in other classes as well. It's a great social place to be. So put yourself out there, exchange numbers right away. And then the very last thing I'll mention, if you're in Biostats 1, your lab group is going to become some of the closest people you know in this program, because it's a challenging course. It's a great course. but it's a challenging course. If you're like me and not a STEM person, those people will become your rock, and you will persevere through the semester with them because you're in that shared challenging experience.
The other thing I'll say is to go to all of the welcome events that happen. If you're in the ENHS PhD program, we have a welcome happy hour on September 8th. I hope you got the calendar invitation for that. But there are a lot of programs and clubs that are going to be having welcome meetings and events, so please go to those. Oh, so I think one of the reasons why we're here is we're kind of the students who kind of plan everything in our group, and so every semester happy hour or bowling party or holiday party, I'm usually the one putting it together, and so it's okay for you guys to get a group of people together and do that because it really cultivates a collaborative environment and also allows people to step outside of their shell. If they're not comfortable with organizing things, they can at least attend something and meet somebody else, so you're really helping people by doing that.
And go to them. It's a fun time.
Yeah. I will also say getting to know people in your classes, you don't have to be best friends with them, but you're going to do so many group projects. Public health as a field is so group work oriented, such a big team-based field. So if you know your classmates, it's going to make group projects a lot more fun, and if not fun, at least tolerable, easy. You're going to get it done. So getting to know those people so it's a little more comfortable is always a great way to do it. And then utilize the social spaces on campus. The Sphere Lounge is just for School of Public Health students. It is over in Mayo, down on the first floor. I'll be there tomorrow as part of orientation day 2 for you to come see the space, but there's always people down there hanging out between classes, eating lunch, having a snack, studying. The Student Senate office is down there, so there will often be one of us. We have snacks in the office, so that's a good reason to check us out. But there are social spaces all over campus, kind of like the Caribou and Moose, where you can just kind of hang out, chat, catch people between classes. I think everyone is kind of excited to be back on campus last year and again this year. So people are excited to see each other. Okay, jumping to our next topic. The elusive work-class-life balance. So I know that no one here probably has the perfect balance figured out, but we have some tips and tricks to help. So we're going to chat a little bit about finding some of those work involvements on campus or off campus, and then how we do our very best to balance it all.
So I'll get started by saying that if you do not have an RA or a GA position right now, you do not need to go get one. When I was in your very seats this time last year, there was an amazing panel of amazing students, and they all had like 14 and a half different jobs already. And I'm like at lunch trying to find a job really fast. And of course I didn't get one because I'm not qualified for it yet. So you don't need a job yet if you don't have one. I will also just say the process of getting a research or graduate assistant on campus is a lot of applications that are often followed by no email response invitation to apply. It's kind of sucky. It's just how it goes. Eventually you may get an email and then you get that job. It's an amazing thing. But just be prepared that you don't have to apply right away because you don't need one if you don't need one. You're not behind in any way, shape, or form. But also know you'll often not hear back right away. Another connection is to reach out to the faculty and researchers that are on campus that are doing things that you're interested in. Ask, is there any opportunity to engage in the research you're doing? Sometimes it's paid, sometimes it's not paid. If you start unpaid, much like I did, maybe one day they'll be like, hey, we actually have money now, let's start paying you. It's a beautiful thing. So engage with things you're interested in. If you're not interested in a job, you don't have to apply to it. I did this too much last year, and I just need you all to know that. As for getting off-campus jobs, first thing I'll say, professors are here to help and work with you. So if you get an off-campus job and every single Friday you work from right when your class gets out till midnight or some, ridiculous thing, and all of your assignments in the class are due Friday, talk to the professor, see if you can get it moved. It's more likely than not that they'll work with you, move it to Saturday at noon or, some different time. In order to find off-campus jobs, I would suggest, the class speakers that come in, talk to them after class. You do really cool work. Can I work for you? those kind of great connections. Do informational email interviews, all that good stuff. Work with your faculty advisor, work with your program coordinators to see if they have places that are looking, first of all, and then you can start applying to those things. You also get a bajillion emails, as we've said a bajillion times. Read them, make time to go through and apply to the things, because more likely than not, they sent it because they want an SPH student to apply, and that would be you now. So take time to go through your email. I'll super quick talk about balance just so I don't steal the mic back again. I'll just say if you're coming straight from undergrad and managed like 3 campus jobs and an off-campus job and you still walked your dog 3 times a day, grad school is going to be different. You need to make time to make sure you're eating, you're sleeping, you're showering, you're seeing your friends, you're doing things that fulfill you, as well as your schoolwork. So be sure you're taking care of yourself, be sure you're working on school, and then see the things that can fill in after the fact. You don't need to have 15 jobs. I'm going to say it one more time. You don't need to have it. So.
This is a little different for the PhD program because most of the PhD students are funded through graduate research assistantships. So if you already don't have one set up with your advisor will be very instrumental in helping you find some funding that's going to help you get through these years of the program. And so if you haven't had that conversation yet, which is highly unlikely, I strongly suggest that you do have that conversation with your advisor about finding funding. In terms of work-life balance, if you're a PhD student, I imagine you might be very overwhelmed right now because you have at least 4 years, which is a very large chunk of time to completely manage on your own. And it takes a lot of organization and self-discipline to do that. I will say right now, you don't need to know what your dissertation is going to be about today. So if somebody is asking you, what is your dissertation going to be about? Please tell them Madura said I didn't need to know what my dissertation is going to be about today. It's okay to take the time to figure out what you're passionate about in your first year and figure out what you want to do this massive project on. And so take it easy. Also, it's very easy, especially if you're coming from a full-time job or if you're going to be continuing to do a full-time job, it's very difficult to let go of schoolwork at the end of the day. And so protect some of your time and close the book and set aside some time to not be focusing on schoolwork, and that will really help you.
Yeah. Aren't they wonderful? I would echo everything Bob said about GA positions. I know it can seem super overwhelming because that's a lot of money that comes with those jobs, and so it feels a little anxiety inducing when you don't have that lined up yet. If it's going to work out, it's going to work out. And it might be a lot of legwork. It might be a lot of interviews that feel like they went really well, and then you get a no anyways. I applied and applied and applied all last fall and didn't get a position until November. But I found a great lab. I'm working with a great team. And now that I'm in, when the lab coordinator's like, hey, we have a job. Do you know of anybody? Then I can turn around and be like, helping my own network. So utilize your peer connections too, because oftentimes faculty don't know what students are interested or qualified or would be a good fit. And if you are able to kind of help get them connected to the right people and also get your classmates connected, that can be a really great way to build that team up. And then I will also echo what Madura said about setting boundaries of your time. Knowing yourself is really important. What your time looks like, what your schedule looks like is not going to be the same as everybody else. I know I go to bed at 9:30 because I get up at 5:30 because that's what works best for me. So I answer emails at like 6 in the morning. I schedule them to send at 9, but I'll answer them at 6. But I have friends who stay up till midnight and don't get up till 9 because that's just what works best for them. And no one has any power over your schedule other than you, even if it feels like they do. So just getting to know yourself, which can be tricky. You have to be a person before you can be a student. And if you're not taking care of yourself as a person, you cannot take care of yourself as a student, which can be hard to learn, and sometimes we have to learn it the hard way. But I promise it's all going to work out.
I did the same thing last time. A brief word on imposter syndrome. It's more likely than not. I so prefaced it better last time, too. I'm so sorry. It's more likely than not that if not all, a majority of your cohort mates are probably feeling a bit of imposter syndrome. It's kind of wild to be somewhere out in the world and all of a sudden you're here in this new place and among these really amazing faculty and other students. Just know that everyone else is feeling it. talk about it early and soon. It's how you can kind of break down some of that vulnerability with these classmates that you're going to be spending the next couple of years with. But talk about it because it's a shared experience. Everyone deserves to be here, and it's going to be okay.
Yeah. So, I guess kind of a segue. I don't know. We're going to jump over to academic experience and support. I know there is often a lot of concern about adjusting to the rigor of a graduate level curriculum and managing that, and also where you go when you need a little extra support, help, or even just like someone in your corner telling you that it's all going to be okay. And there are a million places to get that. So I will let our panel members share a little bit more.
In terms of academic support, I relied on my peers quite a bit. If you're starting like you said, the biostat series, the epi series, the doctoral level epi series, you're really going to need friends. So please make them in your class and study with them. And if you do have imposter syndrome, you can use that to fuel your drive to do better because you can study before your study groups with your friends. And then you'll know more about the material, which really worked for me. The second thing is the faculty here are very open to meeting with students. I never had a bad experience with that. I reached out, you went to office hours, you talked through problems, and they want you to succeed in this program. Nobody wants you to fail in this program. So use your resources.
Absolutely. I'll just say to the nature of work, it's not undergrad because it's called grad school. So just, keep that in your mind. But I also want to encourage that in most classes, as Kaelin said, it's a lot of group work. There's a lot of products that come at the end of a class. So instead of doing 15 busy work assignments, you're probably going to do 2 to 3 really big product-driven things, and those things can then be used as you apply to a job. I always use the example, if you take the health policy course, you're going to write this amazing policy brief that has been scrutinized by 3 TAs and 2 professors, and it's going to be something you've rewritten 4 to 5 times, but it's going to be some of the best writing you've ever done because of all of that. Now you have this beautiful thing, it's something you care about, and then you can use it to apply to a job. And a lot of the classes in the School of Public Health are oriented that way, to have a final product that says, hey, I know how to do this thing, and here's evidence of that. So when you're in hour 47 of an assignment, understand that when you finish it, it'll be something that you can use in the future. I'll also say as an asterisk, your assignments will not all take 47 hours. I use that as an exaggeration and an example. Some of them do, but not all of them. As a form of support, can't reiterate enough, connect with your peers, awkwardly give each other numbers, say random guy I sat 3 seats down to who has a purple, shoe on or some ridiculous thing. Eventually get their name and change the contact, but add people, build your network. When you miss a lecture or you don't understand something that somebody said in biostats, you have those people to text and people to study and work with. Reach out to your professors, your TAs, all those good things. And then lastly, I'll just say that the faculty who are not teaching the class can also speak to a class. So if you're taking a class and you just really don't understand how a professor is explaining something, there's probably another professor in that division that the faculty member may even suggest, or just reach out to be like, hey, I'm learning about this concept in biostats. I don't get it. Please help me. And they have a different perspective and a different approach to teaching it. So take advantage of that. It's not going to hurt your professor's feelings. It's going to help you learn, which is important.
Quickly, if you don't understand something in class, it's highly likely that somebody else doesn't understand it too. So please don't be afraid to ask a question that sounds stupid in your head, but is not actually stupid.
Absolutely.
I'll speak to the other introverted, working by themselves solo folks out there. If you are like me and like to do your work on your own, find somewhere that's not your apartment to go get some work done. If it's the library, if it's a social space on campus, if it's a coffee shop you really like. When it's nice, I love studying outside. I just know that if I'm in my apartment, I'll see the dirty dishes on the counter or that little laundry I could get started. Or maybe I'll vacuum my rug or turn the TV on and 3 hours later I've gotten nothing done. So it can be helpful just to have another space. And then for your resources, they mentioned some fantastic ones. I will also plug our brand new SPH Tutor that we will have starting this fall. This is going to be kind of a one-stop point person within the Student Services Center. So if you're struggling with your classes, you can reach out to them. They will be able to connect you with the appropriate resources, mentors, tutors, faculty members within that division, specifically for the core public health classes, but they can help you connect with anyone for any class. That is the entire job for this student, is to help you get connected. And then I will also plug the Senate Buddy program. In that program, we'll match new student with a returning student, and more likely than not, that returning student will have taken those classes, especially if it's that public health core. They can give you some study strategies, some tips to get through some of those assignments, or just be there to be like, you know what, it sucked, I get it, but I did it, and you can do it too. Like, you'll get through it even if it stinks. So utilize those networks, utilize the resources. The School of Public Health website has links to all of these additional resources if you don't remember what I say today or what we say today. So moving into our last big topic, managing stress and mental health while a grad student. That is a big concern, I know, especially the harder your classes get, the harder it can be to manage that stress in a healthy way. So we're going to chat a little bit about ways we try to prioritize our mental health and well-being, and then also those resources we utilize when we need a little extra support.
I'll get started by saying something similar to what Medora had said, is knowing your exact passion and what you want to do with the rest of your life is a very stressful thing to do, and something that probably isn't appropriate for your first semester of grad school. I'll just give you the freedom to feel that way. When you're taking a lot of the core classes, the icebreaker is, okay, what's your name? What are your pronouns? What program are you in? And what do you want to do for the rest of your life? And I'm like, public health, I don't know, so it's okay to take those classes and learn the things that you care about, whether that's rural health, whether it, what population and community you want to serve. So it's okay to not know that yet. I'll also add, talking to your fellow students, your cohort mates, and other students, we're very in similar boats. The experience you're feeling is most likely being experienced by other people. So lean on each other. Open up about those things, because really, people are feeling the same thing. Last thing I'll mention, I'm stealing this from Kaelin, so sorry. SPH has a great mental health advocate program. So there's people embedded in the School of Public Health who are designed to make sure that you're connected to the mental health resources that you need. Utilize them. They're heavily trained professionals who want to make sure that you're well and successful as you navigate grad school.
In the doctoral program, you'll spend the first couple years doing all of your coursework, and then later on focus your efforts on your research. It's okay to focus on your coursework the first couple of years and say no to other projects. Like, I know you might have to do your RA-ship work, but saying no to clubs and organizations and extra research and extra projects because you really are a student first, and prioritizing that really helped me succeed in my classes the first couple of years, which is very important. And it helps you. If you're focusing on your courses, you're going to be learning more and devoting your time and energy to that. So I recommend that.
Yeah, I would also, I know we talked about it before, all of these topics kind of blur into each other. You can't separate one aspect of being a student from anything else, but really being protective of your time and of your energy, setting those boundaries, even if it feels a little iffy in the moment, to say no to things. If you know that's what's going to be best for you, like, say no with conviction. You know yourself. You know what you're capable of. And then also schedule in fun things to do. I know it can feel like you need to be doing classwork and job applications and research and PhD applications or med school applications or law school applications or whatever you feel like you need to be doing. But it's okay to be like, nope. On Thursday, we're going to trivia. On Saturday, we're all going to the movies. We're going to bowl or mini golf or whatever. We live in a really cool community and there's a lot to do, and you're going to be really bummed if you don't take advantage of that, and you're also going to get really burnt out if you don't make time to have fun with all of these amazing people that are sitting in this room with you, that you're going to meet throughout the next weeks, months, years. It's a really great community to kind of build up connections for the rest of your life, because, I mean, if you get into this mentor or choose to be a part of the mentor program, you're going to hear from the alumni about the connections they made as a student and how beneficial those are, not just right now, but for the rest of their lives, to have that support network to lean on. And then for resources, I, in addition to the mental health advocates, will plug counseling services over at Boynton. Those are available to you as a student. I believe those are linked right on our SPH website. We will also have PAWS, which is Pet Away Worry and Stress. That is a campus organization, and they bring in therapy dogs. They have different spots around campus that they are, but we will have them right in HSEC for us this year. I believe it's Mondays, maybe 1 or 2 Mondays a month. So that's super fun. Just something to do. We will also have the Makerspace, which you'll get to check out tomorrow if you're coming back for those workshops. If you're someone who likes to get creative and crafty to take care of your mental health, there's a whole wonderful space through the libraries set up for you to do just that. I believe those are our topics, and we have just a few minutes, so I'm going to wrap us up with kind of some parting wisdom, I guess. But utilize your resources. We talked about so much today. I don't expect you to remember half of what we said. You're going to be talked at a lot today. But if you have questions, reach out, start local. This says start with your program coordinator. You can start smaller. Talk to a professor, a TA, a classmate. They might be able to get you connected. Reach out to that program coordinator, director of your program, or SPH Student Services. All of these people are here to make sure you have the best experience possible and are a successful student. Trying something new. You can do anything, you can't do everything. I know that sounds like a cheesy bumper sticker, but it's true. There's so much to get involved in, and unfortunately you can't do everything. So try a few things, attend some welcome events, reach out and ask professors about things happening, and then be intentional with your time. And then finally, to stay informed, read the Student Sphere, read the Student Sphere, read the Student Sphere. I know it seems so boring to read a newsletter on a Monday morning, but there's so much good stuff in there. There's cool research happening, there's events, there's job opportunities, volunteer opportunities, cool, I think I said research already. So much good stuff in there. And then you can also check out our website. We have a link right to all of the resources for you. They're divided, I believe, by School of Public Health and the university as a whole, because those are both places you can go to get extra, good grief, sorry, to get some extra support. There'll be links directly to everything. There's also event calendars. The School of Public Health as a whole has an event calendar with everything going on. You can add it right to your personal Google Calendar. And then I know a lot of student organizations will have their own event calendars that you can also add in, and we'll try to get I'm speaking as Senate, but I know others do as well. We try to get our things on that main calendar too. And then I will just say that we will all be around today for lunch, which is where we're going next. So if you have more questions, just want to chat, we'll be here. And then tomorrow we have day 2 of orientation. So this panel, we kind of touched on a lot of those concerns that you alluded to in those RSVP forms. Tomorrow we have specific workshops designed around the top questions that students have. So we have chances to meet with folks about scholarship, applied practices, internships, libraries is doing a presentation, and then we'll have social spaces for you to meet each other, meet some returning students, and maybe just have some room to decompress. I'll be down in the Sphere Lounge tomorrow morning with coffee and fruit and candy, because I still have candy from the resource fair, and we'll have some great folks down to meet. We'll have tours going, we'll have lunch tomorrow, and then we'll be heading over to the Makerspace in the afternoon for, again, social space, some tours, and then we'll have our mental health advocates there in the afternoon to meet you all as well. So excited to have you all here. Welcome, welcome. I know it's a really overwhelming couple of days, but it's so exciting to have you all. It was so nice to meet everyone and get to share some of our experiences. I hope you have a fantastic rest of your day. I know we're ending a minute early, but we'll end a minute early. I don't know, Ned's gonna let you out. Sorry, I keep ending like a minute early and then not being able to let you go. Are they wrapping up? Okay.
We're just waiting.